Okay, let's go ahead and get started here. First of all, I'd like to welcome everybody for coming to our webinar today on testing the community reception centers and interactive deep dive with the R7DHRE Radiation Specialty Team. And I'm going to introduce our guests, our speakers here real quick. First up, we have Frank Rutar. Frank is the Director of Radiation Safety here at UNMC in Nebraska Medicine, where he's been for nearly 30 years. He tells us that that anniversary is coming up soon, actually. He's a certified health physicist with a master's in radiation health physics from Georgia Tech. And Frank's role has him involved in all aspects of safe and compliant use of radiation on the UNMC and the Nebraska Med campus, as well as the Omaha VA and Children's of Omaha. Also with us today, we have Angela Leak. She is the founder and principal health physicist of Quantum Radiation Solutions, where she develops comprehensive solutions for radiological emergency response and regulatory needs. Prior to this role, Dr. Leek spent 2+ years providing consulting services with Summit ET and 16 years at the Iowa Department of Health and Human Services, which included overseeing the radiation control program. Her responsibilities also included serving as Iowa's liaison to federal agencies and national organizations, such as the Nuclear Regulatory Commission and the Organization of Agreement States. Dr. Leek's contributions to radiation protection are extensive, with numerous publications and invited presentations. She is a certified health physicist with the American Academy of Health Physics and serves on the board of directors of the Health Physics Society. Dr. Leek co-authored a chapter in the Oxford Handbook of Nuclear Security and has published multiple peer-reviewed articles. Her international experience includes workshops and exercises in various countries, and she has contributed to initiatives with the National Academies of Science, Engineering, and Medicine, and several federal agencies. Dr. Leek earned her PhD from Iowa State University and a master's in radiation health physics from Oregon State University. And with that, I will turn it over to Angela and Frank to take us away.
Well, welcome everyone. I'm going to start off first. Welcome again. My name's Frank Rutar, and you already got my introduction. And myself and Angela Leek, we're the leads for the Radiation Health Specialty Team for Region 7 for the Disaster Health Response ecosystem. Anyway, today's webinar is going to be a little bit unique. It's going to be, as was indicated, a very interactive session where we're going to be using the CDC's simulation game. This is a test, Community Reception Center, CRC. And this game was designed by the CDC to help you understand and prepare for like the real world challenges in setting up and operating a CRC in a radiation event. And like, if you have any questions, once again, use the chat or, the raise hands feature. Okay, let's go to the next one real quick. This is, a word from our sponsor, I guess. So we have to talk about this real quick. What is the Regional Disaster Health Response System, if you don't know by now? So if a disaster occurs, whether it's an earthquake or a mass shooting or a dirty bomb, it's going to overwhelm the community hospitals, no doubt. And in particular, rural places, rural hospitals may not have really limited resources to do it. So ASPR recognized, this gap. And so what they did in 2018, they started, awarding grants to regional healthcare systems to try to develop plans, policies, partnerships, so they could, so hospitals and medical healthcare systems could tackle these disasters more effectively. And the first two that were awarded grants were Mass General in Boston and Nebraska Medicine in Omaha. And since then, we've got two more, one in Denver and one in at Emory University in Georgia, in Atlanta, Georgia. And like I said, the goal is to develop and establish, promising practices for improving readiness with a progress of building a national system for readiness built on these regional collaborations. So here in Region 7, what we did is we developed specialty teams to kind of help bridge that gap between, local capabilities when it occurs and then when the arrival of federal assets, which may not occur for quite a while. These teams can be deployed in person because they're regional, or we can provide, support via telehealth or whatever communication platform they want to use. So we can offer rapid subject matter expertise during these emergencies. Okay, so let's go next one. And okay, we're the leads again. Those are good pictures of us, so I like that. And then there's also a map. What we have in our Region 7 is we have 5 medical cancer centers that are part of RI10, which is the Radiation Injury Treatment Network. If you want to find more about it, it's on, there's stuff on our website, as well as just going to RITN. If you don't know what it is, it's basically a national network of 80 large cancer centers with expertise in bone marrow transplantations, which is applicable for say like improvised nuclear device or a nuclear bomb, where there could be a lot of acute radiation syndrome. Okay. Now we're going to go whip through this. Here are the learning objectives. You saw this. What we really want to do is get to a CRC, the CRC simulation game, but we'll talk a little bit about radiation, CRC overview, and some of the aspects of that. Let's go ahead and move to the next one. As you can tell, I'm trying to get to the game real fast. So anyway, when I first heard of a community reception center, what do I think of? I think of a hurricane, and I think of these community support centers that are set up by Red Cross or FEMA or something like that, where they provide like shelter and food and basic, resources and financial aid. And these are all recognizable. However, the CRC is different. Angela, are you still on? Because she's controlling. So go ahead to the next slide. It should be, yes, a CRC is different. Okay, now we can go to the next one because it has a much different purpose. So we can go to the next slide already. So it has a very specific different purpose. It's a specialized facility, and what we are trying to do is you're trying to screen large populations for radioactive contamination. And then as well, you're going to, if they do have contamination, you're going to go ahead and decontaminate them. And we're also going to register people, basically for, long-term health monitoring or follow-up or something like that. So while a CRC, they could provide some of the basic, services that a community support center. I mean, they may have some basic first aid there, or they may have something there, to provide services. Where do I go? I can't go back to my home. But, primarily its goal is to screen for, contamination, decontaminate. So why do you have this? So let's imagine there was a dirty bomb in a populated area, okay? You could have tens of thousands of people worried about are they contaminated or not, or exposed to radiation. You don't have the CRC in place. Where are they going to go? We all know they're going to flock to the emergency rooms. And basically, if they do that, they're going to paralyze the ER's capabilities to treat those who are actually injured or critically ill. So that's why the CRC is essential for protecting public health and the healthcare system in general during a radiological or nuclear event. We have now, I'm going through this relatively fast. On our website, the Region 7 website, we have a ton of information on community reception centers. We have a toolkit, we have videos, we have a previous webinar, a lot of information if you need more further information. But you kind of get the idea of what a community reception center is, I hope, from this. Let's go to the next one. Okay, so quick overview. Maybe a lot of you have already seen this, but we'll go ahead just in case. There's 3 ways a person can receive radiation exposure: external exposure, external contamination, internal contamination. So external exposure, that's when the dust or air around you, it isn't on you, it's around you, but it's giving off gamma rays primarily, which are like X-rays. And so you're getting exposed to radiation. Now, a couple of key points. The person doesn't become radioactive, and once they leave the area, the radiation stops. Okay. The other thing, though, is you can't tell how much radiation they received from external unless it's a huge amount. And then they might have biological, indicators like vomiting, but that's extremely high. The other one is external contamination, as it sounds like. That's dust, radioactivity on your outer part of your body or clothing, okay? Um, these people will continue to be exposed as long as it's on them. And if it's not removed, inevitably it's going to get inside them, inevitably. And that will cause internal contamination, radioactivity within. Also, when you have external contamination, you can potentially be irradiating other people, and you can spread contamination to other, places as well as people. Okay, and the last one is internal contamination, which is, as it sounds, it goes into the body through like inhalation or ingestion or a wound, some way it gets in. It's much harder to remove, and it can result in long-term health effects depending on, the type of radiation, how much. So at the Community Reception Center, our primary mission is really to monitor for the external contamination. In many of these events, there's going to be external contamination if they're exposed to radiation. And that'll be a good indication. Then maybe based off process knowledge, do you think they possibly could be externally contaminated, exposed, or internal contamination? So let's go to the next slide. Here's the, well, good news, I guess. I want to say, I don't want to say it that way, but external radioactive contamination is usually very easy to detect. We can detect very small amounts of radioactivity. And it's also typically easily to remove. And in most cases, you've probably heard this, simply removing the outer clothing can eliminate up to 90% of the external contamination. And then if you follow that with just a thorough shower or washing with lukewarm water and soap, that's typically all you need to remove the remaining particles. Uh, but this simple process, it's a simple process, but it's key to reducing the risk of both continued exposure and internal contamination, and is obviously then why one of the key services provide at a CRC. So while the RAD incidents can be kind of complex, the initial steps to protect people are pretty straightforward and highly effective. So let's go to the next one. So your question is next, well, how many people are going to come to this CRC? And like most health physicists, I just say, well, it depends, right? Really straightforward answer. And it does. Okay, so let's talk about two big ones, right? A dirty bomb. This is not a dirty bomb, but let's talk about a dirty bomb. And it depends on the explosive or the wind conditions, buildings, things like that. Back in, I think it was 2021, I think it was NHI came up with an idea that, or an estimate that up to possibly 20,000 people could be contaminated. That's pretty the high end. Now, keep in mind, we can't sense radiation. The public can't determine if they've been contaminated or not. So how many people do you think were going to come? Probably a lot more than 20,000 because they're concerned that they may have had contamination, things like that. Now, the other one, the really worst case is a nuclear detonation. So we set off a 10 kiloton bomb in Des Moines because that's where Angela is. I didn't do this. Angela did it. It wasn't me trying to blow it up. But and you can see, look at the fallout, and that's the radioactive particles that go up in the air, and that mushroom, and then they're carried downwind. And look how far it can go. It can almost go to Cedar Rapids. So there's could be a ton of people. I mean, many people. And like I said, you'll have people that aren't even in the area. They're going to be wanting to come to the CRC. And if you ever want an idea, look up Goiânia, Brazil in I think it was 87, about the event happened. It wasn't a dirty bomb. It was a spread of contamination, and I think 120,000 people came. Okay, so let's go to the next slide. So here is a really great slide. I like this one. This is a typical flow. Now it could change, okay? It depends, you might not need all these. You might do some registration before the triage, but first of all, they come in and up there, they'll tell you where to go and they come in. Obviously, we hopefully have first aid or medical care for just basic, first aid, cuts or stuff, not serious ones. But if not, and most people hopefully not, they go to the contamination screening. Now they may have portal monitors. That's what we've got shown in the cartoon, which can rapidly determine if there's any external contamination, or they may use, Geiger counters, if that's all they have, right? And then they'll see, is the person contaminated or not? If they're not, then we're likely, and there's a lot of people, we're just going to send them right away to registration, okay? And, get down some pertinent information and then have them leave. However, if they set it off, and it depends on the number of people, what the event is, what you're going to do is probably say, okay, you're going to go to this area, you're going to disrobe, you're going to put it in this bag, we'll tag it, you're going to take a shower, you're going to put on these clean clothes, and you're going to go through again. And if you get through that, then you can go through registration and out again. If they don't, or if there's something where they determine like, well, they potentially could have internal contamination or something, leads them to that belief, we would send them to a radiation dose assessment where we would do further screening. Like we might even, depending, who's involved, we might take urine, okay, to try to determine, is there internal contamination, things like that, before we send them off. And we may not send them off. We may send them off to the hospital for further, follow-up or something like that. Now, things to keep in mind, there's a lot of things to keep in mind, right? When you're dealing with the public, keep families together. I think we've all learned that. Keep them together. And, keep caretakers and service animals together as well. And then keep in mind, you need to assist those with, needs, special needs, and that will take time. And as you'll figure out in this, game, you're going to have to play. What do I got? What should I do? It's tough decisions, and it's going to be very fluid depending on what you've got. So let's go to the next slide. And we put this up here. Anyway, is it like a point of dispensing type? Yeah, it is and it isn't, right? You come in, you kind of do a little triage. Here we're just determining, are they contaminated or not? And if not, we decontaminate them and then try to get them on their way. These people are potentially contaminated. So what's a lot different is we have to take into account contamination control. So we're going to have this area until we know that they are clean, right? They've gone through the portal monitor clean, then they go to a clean area. Otherwise, that the remaining part of the CRC is got to be considered contaminated. Okay, so let's go to the next one. Or do we have an next? And registration is important. If we see something on this, if we do this at the end and we find out, yeah, I was vomiting, like an hour afterwards for a couple times, well, then we might send them back to dose assessment, or we might come back. This is going to be important information to do long-term follow-up and things like that. Okay, let's go to the next one. And obviously, you may need specialized personnel. Having SMEs there, radiation people who can answer questions, having fact sheets ready. People want to know. A lot of people don't know about radiation. This will help. And if possible, you should provide mental health professions for concerned individuals, not only the general public, but even the work staff at the CRC. Okay, next. And just keep in mind, a lot of people, look how many are in the registration. This is how many people you need to staff to do 350 an hour. Obviously, if you got more porta monitors and a lot, you can, but it takes quite a few people to do that. And the registration staff itself, that's going to take a long time. Anyway, let's go on to the next one. And okay. And what agencies? Well, it's a team. It's a team process. Let's just put it that. Here in Nebraska, in Omaha, the Douglas County Public Health is taking the lead, but they're also working with us, Nebraska Medicine and Emergency Management, as well as the state radiation control program. It's you're going to need everyone on board. Next. Oh, that's me. That's not me. That's you, right?
It is. This is our transfer. Thanks so much, Frank, for kind of going through some of that. And so the first few slides were just kind of a little bit of a reminder, a little bit of background information so that we have all of us on the same page as we move into hopefully will be the focus of what we're going to do today, this walkthrough of the test game that was developed by the CDC. I will note, though, and there are some links in the chat that we've been putting in that will take you to our Region 7 DHRE website, and we have all of our past webinars. So we did go through a longer CRC presentation last September. So definitely, if we've left you wanting more about how to set up your facility and some of the other planning considerations, please go back and look at that webinar. But hopefully we've given you just enough today as we walk through what this game is focused on. So I just want to give some kudos to Lauren Finkley, who developed this game as a part of the CDC Radiation Studies section. And a few people in healthcare coalitions have done some of the train the trainer sessions. The interesting thing about this is it is a serious game. It is a game, but it is meant to reflect some of the things that you'd really need to think about as you're planning for a CRC and what some of the impacts of the situation would be. At the end of the presentation here, we're going to have a link to where you can go on the CDC website. You can actually order this game as a true board game. It'll come with like a cardboard bottom, with the big play session. All the little cards are punchable little plastic pieces. The little icons of people over on the right-hand side are little player pieces. The meeple, which are those green and yellow little people at the bottom, those are little wood structures. And so you actually move along the board game. It's pretty interesting. So today what we're going to do is walk through one round of this so you get an idea of how it works and some of the types of discussions that can be facilitated through playing this game. And then, if you're interested in learning more, CDC's website has a lot, and Frank and I are always happy to help you here in Region 7 to, set up a game and play a game through with a group of people that you want to do it with, or even help you get trained on how to do it for your own area. So first, I want to just explain the game itself. So it's set up as a CRC, and some of it's self-explanatory here, but Frank went through and walked through all of the different areas of a community reception center. So we have, of course, the parking lot with the bus and the cars up there. We've got that initial portal screening, which is that brown box. And then, as you can see, as he showed on the other screen as well, if they're clean through the portal monitor, they go straight down to registration. So you can see the green arrows going down over on the left-hand side. On the right-hand side, if they are contaminated, then they go over to decon and then some post-decon survey until they're determined clean. Then they go to the waiting area again and go through registration. So you can see it's the same flow we were just talking about before. So that's what the game board is all about. And then the little pieces that have arrows pointing in, those are pieces that you can add to the board as you get resources or as you have injects that get put into place. And you'll see how this all plays out. Over on the right-hand side of the screen here, there's another little board that gets laid out that reflects the hazard of the area. it reflects the anxiety of the area. So both of these go for the CRC as a whole. So as you make certain decisions, people or your workers or the whole setup can get more anxious because of what's going on based off of the injects. And the hazard can also go up or down. So there's different actions that we can take that can help to mitigate some of the anxiety and hazards as well. And then you see all the little icons in the fatigue. This is where each player plays a different role of someone who would be staffing the CRC. And those individuals can get fatigued. So if we're having them do a bunch of things, they can get more and more fatigued. And if in any of these, the little icon moves over to the right-hand side to the game over, basically game is over. So hopefully you're able to make it all 5 rounds without getting to game over, but you'll see how that plays out here shortly as well. And then down in the staging area, every round you get a certain number of funds. And so this game setup is showing how you start. This would be round 1. It gets to start with all of these items. So we get 10 funds. And then the little people are called meeple, and they're green and yellow. And the yellow ones are equivalent to 1 point. So when you look over on the board and you see like the portal monitor on the left-hand side of the screen, it has a little 5 in the bottom. That means it can process 5 points, basically. So I can either do 5 yellow people or yellow meeple, or I can do 2 green and 1 yellow, because each green one is worth 2. And the reason for that is that those are representing people that might need extra assistance, children, people with needs, access needs, other types of things that you might have to be dealing with. So it's putting some of those extra components into play. And then each of the meeple on the bottom side, so you can't see when they first arrive, they have a star or an X on the bottom. And if they have the X, that means that they are contaminated. So that's how you know which way to move the meeple. You don't actually screen them, obviously. And so if they have the star or the X, then they are contaminated. We also play with different player cards. So there's a couple of additional player cards here that merge a couple of roles. But for the most part, these are the 7 primary roles. And so you can see they're the usual players that you would expect to be a part of a community reception center. You've got emergency management, hospital coordinator, public health, a radiation person, public information officer, fire and police, and volunteer coordinator. And so as we have all of these cards available, there's a session within each round where the players get to use something off of their card. You can see they have different things like self-care or assist waiting meeple or contact the Reserve Corps, Medical Reserve Corps, and things like that. And so you can see how much that might cost, whether it's going to cost you in anxiety or hazard or fatigue, or it's going to cost you in money. And so everyone can work together to figure out what the best actions are based off of where things are at on the board. And the game, each session or each round has 5 phases. So we have the arrival of the meeple that we draw, or that we draw. Phase 2 is processing the meeple. So basically the way the board's set up, you process the meeple in any way you can. Phase 3 is using your funds and resources that you might have. Phase 4, you actually have to react to inject cards, which these are the inject cards. And then phase 5 is when you can actually work through some of these player cards. So it's very methodical through each session so that you can see the impacts of some of the things that you would be doing. So the inject cards, there are major injects and there are minor injects. In each round, you draw 1 major and 3 minor, unless you have people left on the board or you have any of the icons in the upper right-hand corner that have moved to the right. Then you have to either draw extra meeple or draw extra inject cards based off of where your people are or those icons are. If you move to the left of the hazard, anxiety, or fatigue, sometimes you get to draw less. So the inject cards have different things there's supposed to be, and usually are, kind of the things that you would be dealing with, like inclement weather. If you think at your CRC, in your plan, everybody's waiting out in the parking lot for you and you have inclement weather, is that going to work, right? And so this gives you that's consideration in a major inject, and then gives you a couple things to choose from, and you can see the impact of what those would cost you as well. And then the minor inject are things like a confused meeple. Mixed messaging has made them confused, and they're coming in, maybe in the backside on the decon side instead of the clean side of the or the sorting side of the CRC. So how will you handle this? And depending on what you choose, you see those impacts. So that's kind of the basis of the game. Now, I will say, if you go out to the CDC website, there are some great videos that walk through all of this in much more detail to how to lay the board out, how to proceed, and all that kind of stuff. But again, to fit this in, we kind of condensed all of that. So I would encourage you to go check out those longer videos. But I want to play through just a little bit, and this is where we're going to get a little bit interactive with you guys. So we've set up our board. We're ready to play. And so basically we start with a portal monitor that can process 5 people. We have 2 showers, so we can process 2 meeple point people through there. We have 4 monitors at the decon area, and we have 6 desks, so 3 cards with 2 each for the registration at the bottom. We start in the middle of our hazard, anxiety, and fatigue for everything, and we have 4 players for this role, or this round, or this game, I guess. So we're going to have emergency management, the radiation person, a hospital coordinator, and public health. And then we start with 8 meeple in the first round. And so you randomly draw those out of a bag. And we randomly got 5 yellow and 3 green. And we have our 10 funds. So our player card roles for today, again, they're emergency management, hospital coordinator, public health, and radiation. There are many ways that you can play this with different roles. And if you look at your plan and you say, well, we have plans for, these people, I would say play the game with those people and see if you're missing some of the key roles. And these are taking into account generic roles for these individuals or these agencies. In some states and in some cases, emergency management does something that in another state public health might do, or vice versa. And so, always feel free to take that, with the genericism that these are. Okay, so phase 1 is the arrival, and phase 2 is processing the meeple. So we're going to go ahead and play this through because this is the first step that you do in the game. So our meeple move up into the round 1 spot. And so now what we need to do is figure out, what do we want to do? So if we process, and this is where I'd love to hear anything in the Q&A. Well, you could put it in Q&A or you could put it in chat. Should we do we could do 5. So do we do all 5 yellow, or do we, and then we're leaving the green, which again, green means they have some special needs, whether that's access or they're a child or have something that's going to take longer. So, think through what the pros and cons of processing the first 5 would be, and or doing a little bit of both, right? So, and I see Rusty says, yes, 5 yellow, get things rolling. Okay. Any other thoughts on that? And some of this too, so 3 yellow and 1 green, okay. Some of the thoughts on here too is, if you look forward, okay, great, we can get 5 people through, but then once we get over to the showers, if both of those, if all of or more than 2 people are contaminated, somebody's going to get stuck in the contamination area, right? So we're hoping that we have more clean people so that will go. So, yep, and I see depends on your population factors and line buildup. So great, good thoughts. So we're going to go ahead and process. So executive decision was made that we did the 3 yellow and 1 green. 1 of the yellow and 1 of the green were contaminated. The other 2 yellows, meeple, were clean. So the yellows move down to the waiting area, and the other two go over to the contaminated side of the fence.
Haley had a question.
Oh, yeah, go ahead.
Haley, do
Oh,
you,
yeah. I mean, it was just, I know we've kind of moved on from it, but I was
Okay.
gonna say that we would probably need to consider, kind of who was, who were the green people and
Yeah.
kind of what needs that they had because they might need to be prioritized.
Absolutely. Thank you. That is a great thing to bring up. And again, your plans can kind of take that into account a little bit as well for the types of people that you would want to kind of fast track through, or if you created another line of fast track, right? So again, this hopefully as you pause through all these different time stops, we can think through some of those things. So you can kind of see how those discussions can come out. And other people can learn different things to consider at different parts of the plan.
and we also have a comment
Okay.
from Vicky. Doesn't it depend on staffing available? Oh, definitely. I
Yes.
mean, that is huge. I mean, you're really going to have to figure out how you're going to play your cards, right? And allocate resources. So
Yeah,
in
and
real life, could be really tough.
yeah, for sure. And the game here too is trying to replicate that a little bit. So this is replicating your staffing. So you have two showers. You either have two physical showers or you have two people to run the showers, right? Here we have five portal monitors. So we're assuming we have five people to run those or however many we need to run those five portal monitors. So that these little cards here are kind of what you have. So just for kind of information there. So then once we get here, now we have another decision, right? We can only get the yellow guy through, or meeple, I guess, or the green meeple through because the green is worth two. So we'd need to take up both of the resources in the shower to get that person through versus the one yellow to get through. So again, executive decision here to move the green through. We have more than enough post decon or portal monitors, or sorry, handheld monitors, so we can get the green one through. So now they join the waiting area, and they're no longer contaminated. And now we have 6 desks for registration, and we have 2 for the green and 2 for one for each of the yellow, but 2, so 4 total, which means we can get everyone through and they can head off to the shelter or to the other room we have going where they can do just regular support, not related to contamination screening or decon. So now what we have left is a contaminated yellow meeple and waiting to go through the decon area. And we're left with a few meeple in the parking lot, basically. So phase 3 is our funds and resources. So when you go through different rounds of this, you may get resources that you can use the following round. So for example, maybe one of the inject cards says that you get an extra, your neighbor sent you an extra portal monitor, but you can't use it until next round. So you would put it in the staging area and you then could pull that out. So this is when we could pull that out because we now have that access to us. But we don't have any of that. We just have our funds. So our funds are now in play. So back to our board. The next thing that we do is the inject phase. So we draw the one major inject card and 3 minor inject cards. And these are the cards that we drew. So they are many contaminated meeples are showing up and they are contaminated. We also have state support arriving, and so we can choose one of those resources to gain. We have volunteers that are concerned with radiation, and so we have a couple of different ways to handle that. And then we have several meeples that are registering as contaminated even after they've showered. So they may have internal contamination, which is what Frank mentioned earlier. So we need to decide what to do with them. So our choices for all of this. So you can see here how a lot of this discussion would occur. There's pros and cons to handling all of this. And some of this you can plan for. Some of it is going to depend on what you have for actual resources available to you, which is great. Kara's message, understanding that you'll probably never be fully staffed or fully resourced. So keeping that in mind here as well. So when we exceed the contamination threshold, we can establish a new criteria. We can go higher. A lot of times the contamination threshold that's set is pretty conservative. And there are ways that we can raise. So in Fukushima, for example, they ended up raising the contamination threshold because they had so many people to survey. So they raised it so that they could process more people through and actually have more people be able to go, self-decon, take a shower versus having to do really in-depth surveys for a relatively low amount of radiation. So our choices here in the game are we can establish that new criteria, but that's going to make the radiation person have to do some extra work. So they're going to get a fatigue. They have to skip the player action phase because they're busy. So they're not going to be able to offer any of the other support that the card on theirs would offer. And the whole facility is going to go up by 1 anxiety because everyone gets a little nervous when you start messing with that contamination number. We can also keep it the same. But that means that next round, when we get 12 new meeple, they're all going to be contaminated. And you saw we only have 2 showers. So that's going to be a big bottleneck that's going to be created there. So this is how we can kind of think about this. State support, there's many different ways that we can think about this, which would be the most beneficial to us, right? So if we get a mobile decontent, I believe it has 5 shower capabilities. So, that might be a good choice for us to think about. Portal monitors are always good too, because if we have clean people, you can get more of the clean people through. We can reduce our fatigue by giving staff support, and we can get more funds because we can buy things periodically throughout the game as well. And so sometimes having some funds is helpful. Volunteers concerned with radiation, we can do the RITN, or the Radiation Injury Treatment Network's just-in-time training, and a volunteer coordinator can help coordinate that. They would be doing some work, so they would go up by 1 in fatigue, but we don't have a volunteer coordinator playing with us today. So we only have the radiation option available to us today. So that means the rad person is going to go up 1 in fatigue because they're going to do some on-site rad training. And then dose assessment, we have the choice to go ahead and assess dose and collect urine on site, or we can refer them to the hospital. Now, a lot of plans talk about referring straight to the hospital, but in the game here, we have to kind of think a little bit about this. So if we don't want all of our meeple to be contaminated because of the contamination threshold card, that means the radiation person's going to go up 1 in anxiety. We also, if we refer to the hospital, our facility goes up by 2 in anxiety. And if you remember, if we look at the board, if we go up by 5, game is over. So we're going to be going up 3 in anxiety if we choose all of that. Plus, because we left some people on the board, those meeples are in the parking lot, we have to go up 2 anxiety at the end of the game. So we basically can't do both of those that increase our anxiety because as soon as the end of the round happens, we'll be game over. So we have to take some of those things into consideration. Now, when you're having these conversations in your planning, based off of your plan, you might be like, we would never collect urine at a community reception center. Some of it you just have to play the game, right? Because we can't go up +2 in anxiety. So we either need to choose to have all of our contaminated meeple, or we have to do something. So this is where you can have conversations about the pros and cons of things, but then you have to let the game play out. So we're going to go ahead and fast forward because I do know we're getting toward the end of the hour as well, and I want to make sure that you guys have time to inject or ask any questions. So what we went ahead and decided as a group playing is that we were going to get one more portal monitor. We were going to go ahead and assess dose and collect urine because we can't afford those 2 anxieties. We are going to establish a new criteria for the contamination screening threshold, and we're going to provide on-site radiation training. So what that means is we get to gain that 1 portal monitor. So you see that got added to our contamination screening area. Our radiation person goes up 1 anxiety 1 fatigue because they're doing that on-site radiation training. Our anxiety goes up by 1 because we established a new criteria, and the radiation person goes up as well, because we decided to assess dose and collect urine. So we saw that the public health person went up by 2 and the radiation person went up by 2 more. And the radiation person also went up by another fatigue. So radiation person went up by 4 fatigues. So you can see that's where they ended. And then the public health person went up by 2 because of all those decisions that we made. So now phase 5 is where we get out those player action cards. So these are the cards, and now we can try to mitigate some of this. So sometimes when you draw injects, you get lots of good injects, and sometimes when you draw, you get lots of bad injects. So you might be feeling right now like, oh my gosh, like we're about game over. But you do have a lot of things that can happen in here. And we're not going to go through every single one of these things, but these are a lot of the things that you could have these various players and these various agencies bring to the table. And they can try to mitigate. So if it's things you haven't thought about or that aren't in your plan already, you can kind of see the impact of having some of these. So psychological first aid on the public health is a nice one because that can help another staff member reduce their fatigue. So they get to go down by 2 fatigues if you use one. And you can only use that twice per game. So you kind of have to strategize and think whether it's a good time. Emergency management can request federal support. They can also purchase some things. They can also, the hospital coordinator can get an ambulance, then that helps with some of the people who need to get hospital attention, like especially if you get one of those injects that you have some people that are injured. The radiation person can request more radiation resources. They can train people. They can do everybody can do self-care, which helps get their own fatigue down. But this turn, the radiation person doesn't get to do it because they are busy resetting the threshold. So as you know, you can kind of take a look here as we look at these choices and we look at our board, we think, gosh, what are going to be the better things to do here? So again, executively, as we talked as a group, decided to use psychological first aid. So the public health person did psychological first aid for the radiation person so that they could go down by 2 fatigues and get us further away from game over. We also had the hospital coordinator collected consent forms, which reduced our anxiety by 1. That will help because we still have to go up 2 anxieties because of the other players still on the board. And then the emergency management asked for some immediate support of 4 handheld detectors and 4 more funds. So there's more detectors now available at the end of decon and 4 more funds for us to use in one of the next rounds. Now, pros and cons of all of this, right? You can take a look as you're playing this game. It's great that we added some more portal handheld monitors at the end of the showers, but we're still going to bottleneck at the showers. You can see that, right? And registration is going to quickly start to back up as well. So you can start to be thinking in your mind like, oof, I can start to see what's going to start to happen here. How can we plan forward for the next rounds? But you're kind of stuck with where you have. And that's where we are. So we're at the end of round 1 now. Because we have those 2 yellow meeple in the parking area, we have to increase our anxiety by 2. So we're back up there. So now, since we have players that are inside the orange for fatigue, and we have the anxiety icon in the orange, we have to draw an extra meeple and we have to draw an extra inject card. So we're going to start round 2 with all of that in mind. So we're going to draw 12 meeple because that's just what we get in the next round. We're going to add 10 funds and we're going to draw 1 major and 3 minor injects plus that extra inject. So we'll get the board reset. Everything stays where it is. We add those funds, we add those extra meeple, and we're ready to play round 2. So we're going to run through round 2 really quickly. We're going to do arrival happened because all those extra meeple are there, but we're going to go ahead and do a process so you can see how the next round of process goes. So if we choose to take those 10, so now we have 10 total meeple points that can go through. We ended up having a couple of more meeple contaminated, 1 green and 1 yellow, and then the rest of them were clean. And so they're down in the waiting area for the registration desk. So now, again, we only have the 2 showers. So if we go ahead and process the green, imagining that they need extra help, we don't want to leave them sitting. That means now, though, that we've left that one yellow meeple who's contaminated in there 2 rounds now. So they've been waiting double. So it's just kind of something to think about. And those are the types of conversations, again, that you can have as you walk this through. So because we have more than enough monitors after the decon, that meeple that's green can go to the waiting area. But now we don't have enough registration desks. So we're going to start to have a backup here because we only have 6 registration desks, but we need 2, 4, 6, 7, 8, 9 meeple points to get all those people through. So if we decide to just go ahead and get all those special needs green meeples through, now we still have 5 yellow meeples still waiting in waiting areas before contamination screen and also after in the waiting area. So you can see how this works. Now we would just continue with rounds 2 through 5, and we would just draw more inject cards, which would cause us to increase or decrease fatigue, anxiety, hazard. We could purchase some things when we do the player action round. Maybe we would decide to do a mobile decontent, which would add some showers, and you can see how that would be beneficial here. We probably need some more registration desks. And then we would start again, and you get another set of meeples, which are going to add to all those meeples that are in our parking lot for round 2. And then you can see how this grows, and you can continue to have these discussions about your plan. And you can try, obviously, if you play through the game, you're going to get the information from the game that's going to show you the impacts based off of how the game is built. And it is based in a lot of work that's been done with CRCs and planning and wait times and things like that. But if you and your plan say we only have 10 contamination screening portals, and you want to play it like that, you'll be able to see the impact of that bottleneck. So definitely different ways you can approach this. But what we really wanted to do was just show you kind of how this game works. Would have loved to have a little bit more interactive conversation about those considerations, but we are a little shy on time. But I would love to have you guys go out to the website, watch the videos that have a little bit more detail about the game and the setup, and reach out to Frank and I, and we're happy to facilitate even an online longer session with you and some of your partners at your facilities or your organizations, or coming to do a train the trainer. So the biggest thing to remember is, it's going to be several hours before a CRC is set up. So if you can work through some of these things, look at where the pinch points are going to be, make sure your plans are as solid as possible, and have some caches ready to go, you're going to get this set up much faster, and you're going to be ready to go quicker. And here are those resources. This population monitoring guide we talked about at the very beginning, it had like a green cover. That's the website you can go to at the CDC for that. And then there's some other ones that you can get to. And then again, our Region 7 resources page, we've got a whole tab just on CRC resources that will take you to some other information as well. So that's what we have for today. And I see there were some questions and things that came through. Yes, and thanks, Kara. There is some expansions, hopefully, as CDC can get back into the process of doing their normal daily job. I hope they're able to continue those expansions and get those out just like this. So you can add an animal module. So if your CRC would take pets, then you would have that module, and then a hospital module as well.
I saw that Kaylin earlier, she had a
Okay.
question about what would some of the recommendations be for the radiation person for a small critical access hospital in the region. And it almost, I always say it depends type. I always hate to say that. One thing is, Kaylin, feel free to reach out to Angela or myself, and we can talk you through seeing what capabilities. One thing we've done in Nebraska is we have determined what resources we do have. And we do have a great working relationship, say for Nebraska, as far as what different hospitals, what the different radiation SMEs are, things like that. And just to know that you've got the Region 7 and you've got a radiation specialty team, that can help you kind of anticipate what things you need. First of all, we'd have to know what capabilities you have and stuff, and what other facilities are near you, things like that. but feel free to call us or contact us.
Yeah, thank you. And Rusty, I see the question on, so in a real CRC, who would coordinate or run it? And that's very jurisdictionally dependent. That is, in some cases, it could be the state, local, city, public health. It could be fire department. It could be a healthcare system. It could be emergency management. And that is really, I would say, the crux of what most of the time before you can really dive into community reception center planning is to figure out who that is. Because, you know, in a nuclear power plant plan, it's usually pretty well scripted out. But think about it for other types of incidents where you can't plan ahead, or the facility you thought you would use in your plan isn't going to be available, or the people that would run it aren't available because of the impacts. So that is probably question number one for each jurisdiction working on their planning, is who would really be in charge of the planning, and then if it got stood up, in charge of running it, and make sure that's clear.
I see Deb has her hand raised, but real quick
Yeah.
before I let her do this, I just want to thank everybody who's joining us. I know we're at the top of the hour and everything, so respecting folks' time. If you need to jump off, that's fine. If you can hang on and you want to ask more questions, by all means, we'll keep going. And like, excuse me, like we mentioned before, all this is being recorded and we'll have it posted within the next couple of days. So if you miss some of the questions, you can go back to the recording and look that up. All right, Deb, go.
Yeah, Angela, you hit the nail on the head on what I was going to basically talk about. It's like it really is important for everybody to reach out to their partners and stakeholders, whether it's the medical community, emergency management community, especially at a nuclear power plant, because there is a lot of stuff that's pre-required for CRCs. We call it RCCs and stuff, but that way you don't necessarily duplicate things, but we also don't address the stuff that deals with like the nuclear attacks or, you know, terrorism attacks and stuff. So you really do have to think these things out with your other partners and stakeholders. So I appreciate you bringing that up.
Awesome. Okay, any other thoughts or questions? All right, I think we're good then. Thank you so much for joining us, and we'll look forward to more outreach with all of you and the next webinar.
Thanks.